Climate change demands a climate action.
Nakakabahala, di ba?
Ano pwede natin gawin?
Here are 10 things to help Mother Nature.
Walk or bike more.
Patayin mo muna yung makina kung hindi ito ginagamit.
Refuse, reduce, reuse, recycle.
Eat more gulay, less or no meat.
Quit burning garbage.
Quit smoking. No to vapes.
Support local.
Mag-ukay-ukay!
Hinay-hinay sa online shopping.
At syempre, ang magtanim ay di biro.
Tandaan, together we can do more.
Celebrate clean air. #Ginhawa.
Climate change demands a climate action.
Nakakabahala, di ba?
Ano pwede natin gawin?
Here are 10 things to help Mother Nature.
Walk or bike more.
Patayin mo muna yung makina kung hindi ito ginagamit.
Refuse, reduce, reuse, recycle.
Eat more gulay, less or no meat.
Quit burning garbage.
Quit smoking. No to vapes.
Support local.
Mag-ukay-ukay!
Hinay-hinay sa online shopping.
At syempre, ang magtanim ay di biro.
Tandaan, together we can do more.
Celebrate clean air. #Ginhawa.
Let us bow our heads and put ourselves in the presence of the Lord. Dear Heavenly Father, we thank you for gathering all of us today. May you bestow your guidance and blessings so that we can enjoy and appreciate its significance in our lives. Bless everyone who are present here today, that each one of us may be able to share our knowledge, understanding, and wisdom for your glory and honor. May the various activities related to this event be a success through your intervention. We all ask of this in the mighty name of Jesus. Amen.
Panatang karangalan ng PCP. Bilang isang tapat na manggagamot PCP, ipinapangako ko na magpapamalas ako ng kabutihan at katapatan sa isip, sa salita at sa gawa. Pangangalagaan ko ang dignidad ng aking propesyon sa lahat ng pagkakataon. Gagalangin ko ang mga kapwa ko manggagawa, kapwa manggagawang pangkalusugan, at iba pang may kinalaman sa aking gawain. Sa wastong pamamaraan lamang ako makikitungo sa mga sanay o industriyang pangkalusugan. Hindi ko pagsasamantalahan ang ugnayang ito at hindi ko ito gagamitin sa pansariling pakinabang. Paninindigan ko ang katapatan at katotohanan at higit sa lahat, uunahin ko ang kapakanan at kabutihan ng aking mga pasyente sa lahat ng pagkakataon.
Good evening, everyone. Welcome to another significant webinar brought to you by the Philippine College of Physicians Committee on Climate Change, Environment, and Health. I'm Dr. Ivy Amante, an internist and endocrinologist and member of the PCP Committee on Climate Change, Environment, and Health. As healthcare professionals, we dedicate our lives to caring for people. But how often do we think about caring for the environment that sustains us all? Today's topic is something we don't often talk about, but we should. The truth about medical wastes. This webinar will open our eyes to show how our actions inside hospitals ripple beyond the walls, affecting air, water, and our communities. More importantly, we will learn what we can do as individuals, as physicians, and as advocates to champion sustainability in our daily practice, inspire others to act, and prove that healing our environment begins with us. So sit back, learn, and be inspired to take action. To officially open our program and give his welcome remarks, may we call on the Region Champion of the PCP Committee on Climate Change, Environment, and Health, Dr. Ian Homer Kua.
Good evening, everyone. So on behalf of the Philippine College of Physicians, officers, and board, I warmly welcome you all to tonight's webinar, The Truth About Medical Waste. This topic is both timely and essential as we continue to balance healthcare delivery with our responsibility to protect the environment. As physicians, our duty extends beyond patient care. It includes ensuring that our practices promote sustainability and public safety. We're privileged to have esteemed colleagues, Dr. Kenneth Koo, head of the PCP Committee on Crisis Preparedness and Management, and Dr. Marie-Yvette Amante, our moderator, who will help us better understand the realities, challenges, and solutions surrounding medical waste management. I would also like to extend my heartfelt congratulations to the PCP Committee on Climate Change, Environment, and Health, ably headed by Dr. Sheila Sonsa, for organizing this very relevant and meaningful activity. Thank you for taking the time to join us this evening, and may this session inspire meaningful action toward a healthier planet and a more responsible healthcare system. Welcome and enjoy the program.
Thank you very much, Dr. Kua, for graciously opening our webinar. Over the past few years, public concern has grown over how healthcare facilities in the Philippines handle medical waste. According to the DENR, the country generated over 7,500 metric tons of infectious waste in recent years. And during the height of the COVID-19 pandemic, this figure surged to around 280 tons per day nationwide. Even today, hospitals continue to produce alarming volumes, A study on DOH hospitals also showed that infectious waste increased by about 25% monthly, while general waste slightly declined. The World Health Organization has likewise warned that the global surge in discarded masks, PPEs, and syringes has overwhelmed waste systems, calling for urgent improvements in healthcare waste management. So medical waste is not just a hospital issue. It's an environmental, community, and a global concern. It affects our air, water, and even those who handle and live near dump sites. So as healthcare professionals, we are reminded that caring for people also means caring for the planet. So today we dive deeper into how we can make healthcare safe for both patients and the environment. To guide us through this important discussion, we are honored to have with us Dr. Kenneth T. Koo. He is the current chair of the PCP Committee on Crisis Preparedness and Management. He is the medical director of the Holy Child Hospital and visiting faculty at the Silliman University Institute of Rehabilitation Sciences. He is the operations head of the Negros Oriental Emergency Rescue Foundation, Medical Corps Officer, Armed Forces of the Philippines Reserve Command with the rank of Major, and Unit Commander of 5051st Technical Administrative Service, 505th Task Group Brigade. He's the chapter commander of the Knights of Rizal Dumaguete City Chapter and member of the Interagency Task Force on Emerging Infectious Disease Negros Oriental and Dumaguete City, visiting member of the Regional Disaster Risk Reduction and Management Council, officer of Civil Defense in Region 7, and member of the Council of CPR of the Philippine Heart Association. He's also a member of the International Society of Nephrology. Let us all welcome Dr. Kenneth T. Koo.
Good evening. I would like to share my slide. So, can I start now? Maririnig niyo lang ako?
Yes po.
Okay.
So, thank you.
I'm presently the Committee on Crisis Preparedness and Management of the Philippine College of Physicians. And this is my members. My region champion is Dr. Ian Kua. And these are my vice chairs. So today, I will be talking about the truth about medical waste. So these are my disclosures. I'm also a member of the Committee on Climate Change, Environment, and Health. So this is the outline of our lecture for today. So overview, we'll discuss swiftly the types of healthcare waste, major sources, health risks, which is the most important, and healthcare waste and safety issues, the environmental and climate impact, why there's waste management failure, and the difference between the new standard today, waste pyrolysis between incineration. So healthcare activities protect and restore healthcare and save lives. This is according to the 2024 World Health Organization blog. But what about the waste and byproducts they generate? So of the total amount of waste generally generated by healthcare activities, about 85% are general non-hazardous waste compared to domestic waste. And only 15% is considered hazardous materials that may be infectious, chemical, and radioactive. So this is the pie chart. So majority, 85%, is non-hazardous waste. And measures to ensure the safe and environmentally sound management healthcare waste can prevent adverse health and environmental impacts from such waste, including the unintended release of biochemical and biological hazards. So this is our Philippine Clean Air Act. which was 22 years last June 23, 2021. And unfortunately, the Philippines is the first nation in the world to ban incinerators outright. So we have banned incinerators in 2021 already. Unfortunately, there are still many incinerators around functioning in the whole Philippines. So these are the types of healthcare waste. So infectious waste, pathological waste, sharps, chemical waste, pharmaceutical, radioactive waste, and non-hazardous general waste. Today, we will be discussing about non-hazardous waste because we know how to take care of the hazardous waste, which is only 15% of all the hospital medical waste generated. So these are the major sources of healthcare waste. So hospitals and other healthcare facilities, laboratories, research centers, mortuary autopsy centers, animal research, blood banks, and nursing homes for the elderly. So high-income countries generate an average of 0.5 kilograms of hazardous waste per hospital bed, while low-income countries generate only around 2.2 kilograms. However, the problem is, in low-income countries, we often do not separate hazardous from non-hazardous waste, making the real quantity of hazardous waste much higher in low-income countries. So the health risk for medical waste. Healthcare waste contains potentially harmful microorganisms that can infect hospital patients, health workers, and the public. Other potential hazards may include drug resistance microorganisms which spread from health facilities into the environment. So these are the other adverse health outcomes: sharps, toxic exposure to pharmaceutical products, chemical burns arising in the context of disinfections, sterilization, or waste treatment activities. And inadequate healthcare treatment can be dangerous for health. Incinerator control results in the release of small particulates that affect the functioning of the respiratory and cardiovascular system. Volatile materials such as mercury, lead, arsenic, and cadmium will damage the immune and neurological system, as well as the kidney, brain, and lungs. The incineration of high metal content materials lead to the spread of toxic metals in the environment. So air pollution arising as a result of the release of particulate matter during medical waste incineration, thermal injuries, radiation burns, and spread of antimicrobial resistance to unsafe storage. Various studies have shown adverse health effects in populations in the vicinities of incinerators, including cancer and reproductive dysfunction. So this is proven around the world. Unfortunately, we have very small data in the Philippines about the cancer and reproductive dysfunction around our MRFs or incinerators. So ashes as a result of the incinerator are hazardous waste are also hazardous. Bottom ash analysis of incinerated medical waste carried in Tanzania indicate that hazardous ash resulting of the presence of large amounts of heavy metals, cadmium, lead, copper, and manganese. And treatment and disposal of healthcare may pose health risks indirectly through the release of pathogen and toxic pollutants. And disposal of untreated healthcare waste in landfills can lead to the contamination of drinking, surface, groundwater if the landfills are not properly constructed. So minimization of healthcare waste should be a priority, with significant reduce the amount of waste that can be handled and treated, that need to be handled and treated. So waste minimization actions include green procurement, which we are doing in the Climate Change Committee, and selecting products where shipping is minimized with less and ecological packaging, switching to reusables when safe and viable, only ordering, receiving pharmaceutical based on documented need, and recycling common items including plastic, paper, and cardboard. So the treatment of healthcare waste chemical disinfectants can result in the release of chemical substance into the environment if those substances are handled, stored, and disposed in an environmentally sound manner. So, however, incineration of waste is widely practiced, but inadequate incineration or the incineration of unsuitable material results in the release of pollutants in the generation of ash waste. So, incinerated materials containing or treated with chlorine can generate dioxins and furans, which is one of the most toxic substances in the world and which will not be gone for how many centuries, which are carcinogenic and has been associated with a range of adverse health effects. Incineration of heavy materials with high metal content can lead to the spread of toxic metals in the environment. So only modern incinerators operating at 850 to 1,100 Celsius and fitted with special gas cleaning equipment are able to comply with the international emission standards for dioxins and furans. We have to remember this one. Only modern incinerators operating at 850 to 1,100 centigrade with special gas cleaning equipment are able to comply with the international emission standards. Alternatives for incineration, such as autoclaving, microwaving, steam treatment integrated with internal mixing, which minimize the formation and release of chemicals or hazardous emissions, should be given consideration in settings where there are sufficient resources to operate and maintain a system and dispose of treated waste. So this is the treatment plant incinerator in Cebu. This is in Palawan. So they are already promoting waste to energy, which is really dirty energy, which I will explain later. So waste management failure. There are several reasons that exist for inadequate healthcare waste services. These include limited legal frameworks, policies, regulations, and guidelines, lack of awareness about the health hazards related to healthcare waste, inadequate training in proper waste management, absence of waste management and disposal system, insufficient and human resources and low finances and human resources and the low priority. And many countries either do not have appropriate regulation and do not monitor and enforce them. In the Philippines, we have a policy, we have a law, which is the Clean Air Act. Unfortunately, our government is not monitoring and enforcing them properly. So the management of healthcare waste requires increased attention and diligence to avoid adverse health outcomes associated with poor practice, including exposure to infectious agents and toxic. So an interesting solution in 2016-15 is the possibility of thermal energy, fuel, and electric production from medical waste. And such studies concerning this issue has been conducted. So one study shows waste disposal syringes treated with pyrolysis at 400 to 500 centigrade were used to produce liquid oil, and produced pyrolysis oil had physical properties similar to that of diesel or premixture. So this is how waste to energy works. So waste collection to the plant and converted to fuel, gas, electricity. So this is what the local governments are harping, waste to energy work. But we have to remember that they have to go to the plant still. This is another diagram of waste to energy. So municipal solid waste, some medical waste are also placed inside and goes into thermochemical incineration, which includes incineration, pyrolysis, and gasification, and converted to either energy. So Fang et al. Showed in 2020 that pyrolysis makes medical waste such as plastic and cotton and glass at 500 degrees can produce liquid fuel. It can be by fractional condensation. And in the different series, biogas from recycled medical cotton waste as a source of biogas recovery using thermophilic digestion conditions was produced and improved biogas yield by 92%. So what is the difference between pyrolysis and incineration? So pyrolysis and incineration are both thermal processes used to treating waste materials, but they operate under different conditions and produce different outcomes. So these are the difference. So pyrolysis occurs in the absence or very limited supply of oxygen, but still need a little amount of oxygen. The temperature ranges from 300 to 600, depending on the material being processed. And incineration higher. Incineration requires abundant supply of oxygen, and temperature is 800 to 120 degrees or more. So this is the picture. So this is incineration. The upper picture is incineration, that is direct heating, while below is pyrolysis, which is indirect heating. The byproducts is pyrolysis produces mixed solid, liquid, and gaseous products. The exact component depends on the feedstock and process conditions. Common outputs include pyrolysis oil and syngas and char, while incineration produces ash as solid residue, which may require special precaution due to potential toxic content. It also produces flue gases, which need to be cleaned before release to minimize environmental impact. And energy recovery is common through heat exchange systems. So this is the fuel for pyrolysis. And this is the product of the pyrolysis and the carbon black, which is, honestly speaking, it's still ash. So environmental impact, generally considered more environmentally friendly because it does not involve direct burning and thus produces fewer emissions. The waste pyrolysis machine equipped with multiple stage emission control system like dust removal and desulfurization tower, which is in line with the EIA standard. Also, it also uses recycled waste into valuable resources. Incineration can lead to insignificant air pollution if not properly managed, including emission of carbon dioxide, nitrous oxide, sulfur, and dioxins and particulates. So we are very afraid of the likes of dioxins and furans. And this is the pyrolysis plant by Korea. So we can see here that the pyrolysis plant still includes the dust removal design. There's still dust. So pyrolysis still produces dust. It also has a gas cleaning system, and it still produces gas. And flue gas purification system. So it still emits toxic gas. So even though they say that it's safer, it still produces gas. So the technology application, pyrolysis is suitable for a wide range of organic materials, including plastic, tires, coal tar, aluminum, waste aluminum, plastic composite materials, biomass, and municipal waste, particularly useful for recycling and resource recovery application. While incineration more commonly applied to municipal solid waste, hazardous waste, and waste, often used where there is need for volume reduction and energy from water streams with low recyclable content. So this is the feedstock for the pyrolysis plant, and these are their final products. So the recyclable areas are produced. So this is my last few slides. Of the total amount of waste generated by healthcare, about 85% is general, non-hazardous waste. The remaining 15% is considered hazardous materials, may be toxic, infectious, toxic, carcinogen, flammable, erosive, and every year an estimated of 16 billion injections are administered worldwide. Open burning and low temperature incineration of healthcare waste can, under circumstances, emit the emissions of dioxin, furans, and particulate matter. So this is what they are opposing upon. And again, how waste to energy work. And still, there's thermochemical, they're still burning with pyrolysis. So that's my last slide. So I will now entertain questions. What is very important right now is the monitoring of the MRF, the recyclable facilities, because we have no independent testing centers for testing for emissions of air on the recyclable, the incinerators or the pyrolysis machines. So I will now entertain questions.
Thank you, Dr. Ken, for that very insightful and eye-opening discussion on medical waste. So we will now open the floor for questions. For the participants, please type in your questions in the Q&A box on the screen. We will try to accommodate as many as we can. So thanks, Dr. Kenneth. While waiting for the others to type their questions, may I ask the first question po? So in the Philippines po, what's the usual way of getting rid of the medical waste po at present? Like in Metro, are we using now?
I know the hospitals are outsourcing medical waste facilities. That is why what we recommend really is we have to ask our medical waste contractors how they convert the waste, if it by incineration, pyrolysis, or by autoclaving. The problem with thermal burning is we convert the plastics into fumes or dioxins and furans. That's why among the best way really to get rid of medical waste is by steam inhalation and grinding the material so that there will be no conversion to toxic fumes. That's the best way really right now. Unfortunately, it's quite big load to autoclave. After autoclaving, steam sterilization and grinding of the medical waste. So that's the most expensive part really. So most of the medical waste facilities in the Philippines are now using energy to waste to energy solution, which is pyrolysis. But the question right now is pyrolysis is still burning. So are we sure that the pyrolysis machine are not producing dioxins or furans? So that's the question. So some of the manufacturers or the local government units will tell us that the quality control of their facilities are up to standard with the emission rate. But the question is, who is doing the testing? Because there is no independent entity to test the air quality of such facilities. So that's our problem right now. The one who are testing their air facilities are the one who are selling the machines itself. So that's our problem. So that is why in Negros Oriental, in Dumaguete, we have an MRF, a so-called pyrolysis incinerator, which was claimed it was pyrolysis and good emission quality. So we are now conducting. We hope na we can be there will be funded by the PCP we are testing if there is increase in incidence in cancer. We have already tested particulate matter with MRF, and it's positive that it has caused more respiratory disease in the past 5 years. So we have reports for that. Right now, we're trying to test the dioxin levels through the eggs, if there is positive dioxin levels within the radius of the MRF.
Thank you po. So still a lot to be done.
Yes. So what's really important is this is a call really to all our ATIs who have our training institution, PCP training institution, who have MRFs or incinerators or pyrolysis or waste to energy plants in your area, to have that test, so that we have an objective test if there's increase in cancer in the area, if there's increase in respiratory disease in the area. And then we go up to how's the dioxin levels in especially the eggs or the soil. Right now, we know that UP Los Baños is doing the molecular 23 test for dioxin levels, furan and dioxin levels in the soil. And we're trying to ask if they can test it with eggs. So that's what we are trying to make a study, and hopefully PCP can fund our training institution in Silliman to do the test.
Oh, thank you po. I think Dr. Belen po has a comment po or a question, sir.
Hello. Good evening, everyone. Good evening.
Good evening,
Dr.
Doc
Ken.
Kuyalit.
Major Ken. I would like to make some inputs, like, for example, way back in 1990, pyrolysis is only one of the two waste-to-energy methods that was approved by the Philippine legislature. It is by the Toxic Substances and Hazardous and Nuclear Waste Control Act of 1990, or Republic Act 6969. So these two things came into being because there was a law that was passed.
Yes.
Then after 9 years, we have the Clean Air Act of 1999. I believe this was during the time of President Gloria Macapagal Arroyo, where they also ban now the use of incineration. So they only allow the waste to energy. The only allowed waste to energy method is pyrolysis. I believe we also need another or an updated law banning also pyrolysis, because it is already updated. And I agree that pyrolysis by itself makes use of high energy or high temperatures, which can only be attained when you use fossil fuels.
Yes.
So in that way, it also adds to an increase in greenhouse gas emissions. So by this, let's say 21st century, the use of waste to energy as a means of waste disposal or management is already so outdated, when in fact we already have autoclave and microwave as means of treating medical wastes. And let me add also that when you use anything that burns, it also releases the so-called UPOPs. It is not similar to K-pop. UPOP are unintentionally produced organic pollutants, which you have already mentioned, like dioxins and furans. And this exists in our food chain, can be also assimilated in our food chain as well as in our environment, and the effects are deleterious to public health. It may also cause skin disorders, and the long-term problems are related to disorders of the nervous system, reproductive, immunological, as well as hematopoietic systems. So I believe at the present time, we need new laws to update our outdated toxic. Don't you agree that we have to pass, when we had to move our legislators to pass new laws that would also consider healthcare in the treatment of wastes? Yes. Thank
But
you.
we need proofs that these so-called pyrolysis centers are causing deleterious health effects. That's why the Negros Oriental sa Dumaguete, sa Siliman is trying to make an objective study regarding that one. Right now, for the past several months, we have an increased surge in leukemia, really. So we have problems. We're just trying to trace is if it is within the how many diameter away from the MRM. So unfortunately, for the past 3 months, we have 3 doctors who died with adult onset leukemia already, all CML. So 1 surgeon died already. The mother of one, the other one, mother of an OB, and one has treatment CML pa rin. So unfortunately, we have increase in incidence of blood cancer right now. So we're just trying to make a objective study, not always hearsay. Na this proof really na the MRF is not doing good, which is using pyrolysis, which is waste to energy.
I truly agree with you. Right now, in the country, we have 2 established pyrolysis plants. No, one is in Lawag, Ilocos Norte,
Yes.
and the other is in Naawan, Misamis Oriental. So probably, if I may suggest, we could ask our colleagues, PCP colleagues in those areas, to probably go and do some studies around those areas. And from
Yes.
those studies, we can build our case, no, and then we can present this to some lawyers.
Legislation.
As a PCP community, we can push for these new laws for using other means, safer means of treating medical wastes.
One of our problems really is an independent testing center for this pyrolysis waste to energy plants, because DNR apparently claims that they don't have a testing center. They send the chemicals abroad, and it's costs a lot. So that's why the LGUs are dependent on the one who are providing the machines. So there's COI, conflict of interest, in the results of their quality air assurance, the quality air of their products. So that's why we have to move, we have to push for an independent establishment to test this waste to energy plants if they are really producing clean air.
Yeah, and then to add to the information that you have presented earlier, the amount of energy or so-called fuel that is generated is not enough to fuel as to be used as fuel for mechanical engines. No, so only about less than 6% of the fuel generated is used or usable. So that is the one of the things that they are pushing, why we should go into waste to energy, because we can use the waste, transform it to energy, then we could use it to drive our automobiles, drive industry. But in fact, it's not enough. We're just consuming too much fossil fuels. So it only negates the intention of being able to convert waste into really proper, useful energy at the end. Thank you.
Well, to add po to that, parang I guess it's not just the air quality po that can be affected, but we should also test the soil, because it can reach really deep into the soil and then up to the waterways also. So parang we can, to add to the air quality, air testing, parang there's so much more other areas po that these toxins can reach.
In addition to that, sa Europe, they're testing eggs. Sa France, they're testing levels of dioxin in eggs. So that's what we are doing in Dumaguete. We're trying to make a protocol on testing eggs, dioxin levels in eggs. So we hope na ma-approve ang MAFAN and we can do the study immediately.
Thank you po. So it's a huge problem. We will try to maybe small steps to solve. Just a quick question po. So this the medical waste management po, what government department or agency does it fall under po? Is it
DNR.
I see. So parang
DNR kasi ang major agency that is involved with that. That's why we're asking DNR if there's a independent testing center for quality air, if the emission is really good. So unfortunately, they could not answer a accurate positive answer for that. So that's why that's the next best thing is not to burn. It's to autoclave or to sterilize and grind so that you will not burn. You will not convert the plastics into gas fumes. So it's not really converting the plastics, it's sterilizing, then grinding so that you can use it in other purposes. So that's really the alternative choice right now. But unfortunately, it will cost a lot more than burning, than pyrolysis and incineration. So that's our big problem because we need very big autoclaves for that. Autoclaves that can fit cars. So kotse talaga ang ipapasok mo to autoclave the whole thing and grind everything to small pieces so that it can become hollow blocks or put it in the sun. So that's the best way really, but it's more expensive.
But now po we don't have that.
There are centers. I know that Tacloban has steam. Sa Divine Word, they're using steam and grinding so that they can make it go to the domestic waste. But I have not seen it personally. But the manufacturer of the autoclave system is claiming that one. They're not burning it. They're sterilizing the medical waste in Divine Word. That was before COVID.
Yes po.
Yes, just to add some interest to our forthcoming lecture on November 4, where we are going to introduce global green and healthy hospitals. No? Actually, right now, they are conducting audits on hospitals. They just finished last July and September the audit of the Quirino Memorial Medical Hospital, the Eastern Visayas Medical Center, and another one, Cagayan Valley Medical Center. And one of the things that they audited was the management of wastes, medical waste, particularly plastic wastes, especially how did they treated, those hospitals treated medical waste and plastic wastes. So perhaps in that coming November 4, that we can also mention and discuss these things as one of the things that we could look forward to as something that would probably we can get some info or some data that we can present and use to work for something that would change the law, update the law on the Clean Air Act of 1999. Okay, so that's it. Okay.
Hopefully, yes, we can lobby po. And maybe for sure the impetus will be coming from medical groups such as the PCP. So thank you po for all these initiatives.
Welcome.
I don't see any questions po in the box. Unless Dr. Sheila. Dr. Sheila, you might want to have some comments or questions.
May ano po sir, thank you for your talk sir. Meron pong anonymous na nag-send ng question. Regarding po sa grinding of plastics, can it produce microplastics that can further seep into the waterways po natin?
Okay. What they claim they will do with the microplastics, 'di ba? I-grind ang plastics. So they can incorporate it with hollow blocks for building materials. So they do not throw the microplastics into the water. They put it into hollow blocks, cement, so that it will help in building concrete. So it will not be thrown to the water. So the idea really is, if we grind to microplastics and we throw it in the water, the microplastics will be ingested by the animals in the water, and it will be go up to the food chain. So what they do is they incorporate it with cement to make for buildings. So that's what they do with the microplastics.
Thank you po, Doc Clark. Dr. Sheila, I cannot see the questions. Baka can you see more questions?
Walang question.
Nag-message lang, yun lang yung isa kong nag-message.
Walang question yata. Amen. Nag-raise.
So thank you po, Dr.
So the point really, that's why I want to have this lecture is to build interest to the ATIs to make such studies in their locality, so that the PCP can have a community study also regarding this one, especially those localities with pyrolysis. Kasi wala nang incinerator. Technically speaking, there's no such thing as incinerators. But unfortunately, the pyrolysis needs the chambers. So kung nagtitipid ang government, lalo na sa nangyayari ngayon, lalo na pag mayroong mga ghost project, yung isa doon sa mga dapat na basic na dapat nandoon, yung gas chamber, pwede yung hindi bibilhin. Yung lang i-heat lang siya, i-burn lang siya, thermal burn lang siya. So that's the problem really. So the pyrolysis machine still has, so sa picture dun sa slide ng Korean product, dapat meron siyang gas chamber para matanggal niya yung emission of the gas really. So dapat kompleto yon. So the question is, how can we test the final product, the gas emission or the soil eggs? Because when gas goes up the air, it usually goes down to the land, soil. So itetest mo yung soil. Tama si Dr. Amante. Kailangan itest din yung soil. The question is, who are testing the soil? Is it an independent body that testing the soil? Or is it the manufacturer of the machine that is trying to test their quality of product, air quality of their product? So there's COI. There's COI, conflict of interest in such thing. So that's the problem really. So that's why in Dumaguete, we really wanted to have an independent testing center for the air quality of our MRF, which was never produced. That's why we're producing studies regarding the effects of that MRF, particulate matter. Right now, we're trying to test for carcinogenics. And we're trying to test for the dioxins with a new study regarding the MRF. Because our PCP has adopted the community. Their community kasi, the MRF community is their adopted community of the training center of Silliman University. So that's why we're doing such studies.
I thank you po. So, parang we have to encourage this nationwide, I think.
Yes, that's why we really need to have a nationwide study regarding, so if those who are ATIs who are interested to do that, you can contact the Climate Change Committee so we can help make a single protocol for the whole Philippines para standardize ang protocol, and we see the results really.
Yes.
So we can make it standardized
Yes,
protocol. So we can see. So ang i-target lang natin talaga is those with pyrolysis centers kasi wala na kunwaring incinerator. But the problem is pyrolysis center pero nagbubuga ng ang itim-itim ng puso. So hindi yun pyrolysis center. It's still incineration. Kasi nagbubuga siya ng black smoke eh. So yun yung problem. Si Doctor.
What a big problem. Yes, Dr. Dan Baltimore. Yes po.
Hello.
Hello,
Sir.
Doctor.
Good evening po, sir. Thank you for your lecture. So siguro, just a practical questions kasi the medical waste that are being produced, hindi lang naman din nanggagaling sa mga hospitals natin. It also comes from the waste, yung mga medical waste coming from our patients. So, any advice po kung paano natin matutulungan yung mga waste from them, from our patients, na mabawasan pa yung mga medical waste natin na ginagawa nila din?
The best thing really is to the doctors to teach their patient how to segregate. Number one is segregate really. So we have also problems in the hospital because once you contaminate hazardous waste with a non-hazardous waste, it becomes hazardous na. So lahat ng paper na sinamahan mo ng syringe na merong blood, magiging hazardous na yun. Kaya nga, yung isang report nga ng World Health, na maski na sabihin natin na sa low-income countries, it's only 0.2 grams per patient bed, it becomes greater because we're not really following segregation. So even our nurses is not following that segregation. So medyo mahirap or malaking task for us to parang silang plaka ka na palagi minsan. Kasi kailangan talagang paulit-ulit na hanggang sa matututo sila. Tapos minsan hindi natututo kasi ang bilis ng turnover ng nurses mo eh.
Oo nga po.
6 na buwan nang wala na sila. Nandun na sila sa dollar sign.
Tapos yung mga bagong nurses, sir, mahirap na rin
tuturuan mo naman. Tapos may sarili naman silang idea kasi mas magaling yata sila sa atin.
Siguro, sir, para sa PCP din, we can make mga infographics.
Yes.
That we can also share sa ating mga patients so we can distribute it to them then siguro.
Yes, we can
part of their teaching.
Yes. Pamphlets na parang yung sa MedRep na na prescription pads na how to segregate. So pwede yun. Para lalo na alam mo naman yung mga sino yung mga patient na bedridden na kailangan ng mga nurses aides. So we can give them the how to.
I mean, sir, kasi most of our patients, di ba, gumagamit ng insulin syringes, tsaka mga vials. So, yung mga insulin pens. So, what I try to tell mga patients na gumagawa niyan, ipunin nila, and then they can give it back to us sa mga clinics para we can help them with the disposal.
So, pwede rin yun na ikaw yung collecting center.
Yes, opo.
Magiging collecting center. So pwede mo rin
Hindi ko lang alam kung magkano per kilo na eh.
bibigyan mo na lang ng discount.
Thank you.
Thank
you, Doc Amante.
Pwede rin yung gawing drive ni Doktora Sonsa
Ayan.
na may discount. Parang senior citizen discount. Ilang syringe ang nabigay mo, may discount ka.
True. Ayan, madami ng assignment po. Yan, medical waste, yung infographic at saka yung ating protocol po na nationwide. Tatlo po yung assignment natin from tonight.
We have already sent our protocol to PCP. So
Ay,
pwedeng
wow.
gayahin yon kung ma-submit. Nag-submit na kami ng protocol. Pinadala ko na kay Ma'am Beth yung protocol ng resident namin. So yung dioxin levels. Right now, I have a first year that is testing, trying to descriptive study on the incidence of cancer for the past 10 years. Tapos ang area niya radius away from the MRF. So yan yung advice ni Dr. Nicodemus. Tingnan natin kung may incidence ba na increasing incidence of cancer in the area. Because we have already a study on particulate matter at 2.5 ppm particulate matter. It's significant. But the problem is ppm kasi hindi mo talaga maiwasan yung automobile smoke. Automobile smoke, kaya pwedeng sabihin ng may-ari ng incinerator na hindi lang sila ang nagbibigay ng respiratory diseases, kundi pati yung mga sasakyan, motorcycle around the area. The cancer really is dioxin levels really is more objective. It's coming from them.
Yes po. For so sure. And even even in the fish po. So aside from the eggs.
Yes, the fish.
Parang we
But
can...
the best thing really sa Europe kasi ang tinitest kasi daw nila is the eggs. They're testing the eggs. That's the easiest way. And sa UP Los Baños kasi sa EMB, they're testing soil. So we're just trying to ask if how to test that soil. But we are following the protocol of eggs sa Europe, sa France, especially sa France. So they claim na sa France, if you have eggs produced within France, bawal na kasi mataas ang dioxin level kasi sa within France. That's why their eggs are imported outside of France. That's what they claim.
Thank you, Dr. Ku. Thank you. We learned so much po, and that's such a big eye-opener and some things we have to check
So
on.
when you go to France, you ask the egg if you're from France or outside France.
How imported. Ang galing. So thank you po. Any more questions? Here, wait. I see one question po. Ito, from Cynthia. Not a question po, but a recommendation to work with LGU and DOH on information dissemination.
Okay. The problem with, okay, I do not know if it's really a problem. But sometimes kasi, pag sa government kasi, honestly speaking, there's ulterior motives kasi from that. That's why ang testing center should be independent from the government. Yun ang what I have learned in Dumaguete. So there's an ulterior motive behind. DOH, yes, but the LGU, sometimes if the head of the LGU is the one promoting the MRF or the pyrolysis center, hindi naman niya gustong magiging positive na dioxin level yung testing center yung incinerator or pyrolysis plant. So that's why we should have an independent testing center. Yun lang ang hinihingi kasi ng Healthcare Without Harm, na we should need a independent testing center, not a bias center. Kasi pag bias kasi, yun ang problem. COI. conflict of interest kasi. So it should be, unfortunately, the machine that tests eggs is around $30,000 US. Nagtanong na kasi kami kasi I just hope na PCP can buy that one. But it's $30,000 US. The machine itself. So that's the problem. But we have seen EMB, so UP Los Baños is testing soil. So we can try the soil testing. So kung may philanthropists na will buy the 30,000 to help us make that studies or test the pyrolysis plants around the Philippines, much better. One test is around $675 US kung ipapadala sa States.
Oh, wow.
Per sample.
So better to do it here po kung meron tayong sarili. If we
Wala, sa internet yun ang sabi, they can test for dioxin levels abroad. Pero may nakita kami report from UP Los Baños. We're still asking if kaya ba. So if ma-approve yung babudgetan, we can ask na EMB Los Baños if they can test so that we can go ahead with the studies.
Have you, last question po, Doctor. Sorry, para overtime na tayo. Pero super last question po. How about, parang in replacement of that testing, parang the eggs, is there like human testing? Kunyari, they test the urine, human urine for these toxins like dioxin, parang metabolite?
Wala, kasi yung tinitingnan kasi natin kasi yung dioxin level will be there forever kasi. Kaya kasi yung particulate yung dioxins will be there. Hindi kasi na-degrade yun. Kaya pwede mong matest yun sa soil, sa eggs, sa water, sa air. Kaya yun ang Pero so far, wala pa akong na-meet na chance na testing, human testing on dioxin levels. Kasi mag-accumulate yan parang sa food chain. We're the highest in the food chain. So lahat ng mga dioxin na kinain natin from starting sa fish, sa meat ng fish, sa egg, mapupunta sa atin lahat. So mag-accumulate yon. Kasi sa food chain, di ba? Parang sa mercury, di ba? Kakainin ng fish, kaya nga ang shark has higher mercury content. Kaya nga pinagbawal ng magtapo ng mercury sa dagat. Kasi nag-accumulate sa meat, sa fish, tapos aakyat dun sa shark. So, pinakataas ang shark mercury content. So far, wala pa kaming na meat na study. So, we hope na kung merong makakuan, they can share the study with us to help us with the study, really. It's a PCP study, really, for all ATIs who are interested.
Thank you. Wow. Thank you po. Very, very interesting and such an eye-opener po. Kulang yung 1 hour po, Doctor.
Ang next na lang na study really is incidence of cancer, respiratory diseases within the radius of the pyrolysis plant or incinerator. Pero minsan kasi tinatago na nila na pyrolysis sila, pero technically speaking, it's still incinerator. Hindi nasunod yung 3 chambers ng pyrolysis. So, yun ang question. Kasi nagbebenta ka ng pyrolysis, pero technically speaking, you're still burning. So, it's still incineration, technically speaking.
Correct.
Binago lang yung pangalan.
That's the challenge.
It's really a challenge.
It's a challenge po. So hopefully we can parang get to this challenge soon.
Yes.
Work on this challenge po soon as a group.
In the near future, after the construction problems in the Philippines.
That's true. Thank you po. Thank you, Dr. Ku. Thank you so much po. So, sorry, wala ng time.
Time, yes.
At this point, we will move on to the awarding of our certificate of our appreciation. So thank you to Dr. Kenneth Koo for sharing his invaluable knowledge as speaker of our very interesting topic tonight, Truth About Medical Wastes. Thank you po so much, and thank you to everyone who participated. Today's discussion has truly shed light on the importance of proper medical waste management, not just a hospital concern, but a shared responsibility among all of us in our community. So let us continue to be mindful stewards of both health and the environment as we move forward. So to formally close our program, may we call on the chair of the PCP Committee on Climate Change, Environment and Health, Dr. Sheila May P. Sonsa.
Good evening, everyone, and thank you for joining us tonight. So as we wrap up this webinar, I want to express my heartfelt appreciation to the PCP Board of Regents, our dear President, Dr. Nemencio A. Nicodemus Jr., and Dr. Ian Homer Kowa, our Regent Champion for the committee, and our dear colleagues, members of the college, chapters, and friends who continue to champion our advocacy for a healthier environment and a more sustainable future. Gratitude as well to our esteemed speaker, Dr. Kenneth Koo, for giving us a very informative talk on medical waste, a very glaring truth that we need to handle, no? Because we are the ones who are giving this much pollution to our environment. And to our very effective moderator, Dr. Ivy Amante, thank you so much. Through Dr. Koo's talk, we know that medical waste is a big contributor at 85% to the pollution in our environment. His lecture is a timely introduction to our committee's major activity next month. It is indeed a challenge to us in the medical field and how we can reduce the volume of these medical wastes. As mentioned, next month we will shed a light on this challenge. So each effort, whether it's an educational campaign, a local initiative, or a simple act of environmental mindfulness, contributes to a much larger movement for change. So once again, I would like to take this opportunity to invite all of you on November 4. We will be officially launching the Global Green and Healthy Hospitals at 10 a.m., which is part of the Day of Rising activity of the chapter. The Day of Rising is held every month of November, which is the annual commemoration of Typhoon Yolanda. This event is hybrid. You can join us via Zoom and the face-to-face at St. Paul's Hospital, Iloilo. This initiative under the Philippine College of Physicians marks another milestone in our collective journey toward greener healthcare systems and environmentally responsible medical practice. We hope all chapters and accredited training institutions, as well as we also invited hospital administrators, medical directors, medical center chiefs of private and government hospitals, and hopefully they will take part and support this important program. Through greening our hospitals, we will lessen our contribution to pollution of our planet. And as we look forward to the coming weeks, I also encourage everyone to join us in the Day of Rising Tree Growing activity this November. Let's take this as a symbolic and meaningful step that reminds us that growth, healing, and hope all begin when we plant something good for the next generation. So again, thank you and see you all soon. Stay safe. Good evening.
Good evening.
Oh, thank you, everyone.
Thank you.
Thank you po.